Sudden cardiac death occurs most frequently in adults in their mid-30s to mid-40s, though it can affect kids as young as 1. So what can go so badly wrong? Do you get a second chance? And can it be prevented? Stand by, Go Healthy for Good starts right now. Hello and welcome to Go Healthy for Good. If no obvious cause can be found when someone dies suddenly, most times it's due to an inherited heart condition. Families are left with a lot of questions, and we're here with some of those answers today. Meet Daniel. He had a different heart problem and was living on a knife edge, though he didn't actually know it. Watch.
I had a job in the mines and as a heavy vehicle operator, a lot of unhealthy eating, a lot of smoking at that particular time. I was a smoker and also was a drinker. I was getting signals and signs that there was something wrong with me, but I was ignoring them. I didn't really sort of think, I just waved it off and I said, oh, well, you know, that's nothing to worry about, and put it down to something else. But this particular Friday afternoon, I'd come home from work in 2019. My plan was to go with a few mates and go down to the club. And then it all of a sudden hit me out of the blue. I had this massive, massive headache. And the people I was boarding with, I said, look, mate, you've got to take me to the hospital. I'm not feeling well at all. By the time he got me to the hospital, which was only about 5 to 10 minutes drive where he lived, because I was very fortunate, I'd lost the right side of my body, my leg, my arm, and just all this side was getting, wasn't working properly, and when I hopped out of the car, I nearly fell over, as I can recall. So I knew something was seriously wrong with me, but I didn't know exactly what it was. They admitted me into the hospital and decided to run blood tests or tests to find out exactly what was going on, what was happening to me. So they observed me overnight, but I had all these things that was running through my mind. I was thinking I was going to die, I was away from family, and I was feeling much alone, and I was in this dark room. I'd taken a week off from work and still they couldn't find anything wrong with me or what was the matter with me. So, but this particular time I said, well, I'm not going to be down here on my own. I want to be back where my medical history, and that was back 1,000 kilometres north from where I was. So I hopped in the car and drove north, back to my hometown, seen the doctors there, and they had a good look at me and they said, oh, look, how'd you get back here? I said, I drove. They said, wow, 1,000 k's? I said, yeah. And they just couldn't believe it because they started to find out things that was wrong with me, and little did I know, they were quite serious.
And he'll share just how serious later in the show. We'll also find out what's good about blueberries, fit in a short workout, and learn from an expert what causes sudden death in people under 40. But first up, the news. In the headlines today, healthy mums give kids 10 disease-free years, sleep habits linked to heart failure, and more meat, more diabetes and heart disease. A mother's influence lasts into adulthood, according to new results from the Framingham Health Study. A total of 2,000 offspring mother-father trios were followed over 46 years for the development of cardiovascular disease. Mothers and fathers were rated on 7 lifestyle factors related to cardiovascular risk and graded accordingly. Father's health did not make a difference, but offspring of women who lived heart-healthy lifestyles lived 9 years longer without cardiovascular disease compared to those whose mothers lived unhealthy lifestyles. Sons were more affected than daughters. So mums, remember your kids are looking on, so show the way. Sleep problems appear to be linked to the development of heart failure. 400,000 participants in the UK Biobank completed a healthy sleep score based on if they are a morning person, if they sleep 7 to 8 hours a night, have little or no insomnia, don't snore, and report no excessive daytime sleepiness. 10 years later, after adjusting for other risk factors, those with the healthiest sleep habits had a 42% reduction in the risk of heart failure compared to those with an unhealthy sleep pattern. Heart failure in early risers was 8% lower, 12% lower in those getting 7 to 8 hours sleep a night, 17% lower in those with no insomnia, and 34% lower with no daytime sleepiness. So do your heart a favour and don't skimp on sleep. We know that meat consumption increases the risk of cancer, but new research has found links to non-cancerous conditions as well. Academics from Oxford University analysed data from almost 500,000 middle-aged Brits and found those eating meat 3 times or more a week had more adverse health behaviours and characteristics than those eating less. Higher consumption of both unprocessed red meat and processed meat gave higher risk of 9 diseases, including heart disease, pneumonia, diverticular disease, colon polyps, and diabetes. Eating more chicken gave more gastric reflux, gastritis, and duodenitis, diverticular disease, gallbladder disease, and diabetes. And each extra 30 grams of chicken a day increased the risk of gastric reflux by 17% and of diabetes by 14%. Every extra 70 grams a day of unprocessed red meat and processed meat upped the risk of ischemic heart disease by 15% and diabetes by 30%, even after adjusting for other lifestyle factors like physical activity, alcohol, and weight. So increase your meat-free days to keep your doctor away. I'm Dr. Nerida McKibben, and that's today's health news. Today's guest is Dr. Martin Stiles, cardiologist from Hamilton, New Zealand. Very occasionally, we hear of a young person who drops in the middle of a game and dies on the field for no apparent reason. I asked Dr. Stiles what the chances are that it's due to their heart.
The chances are quite high that if someone who's had, a collapse suddenly and dies is from their heart. Some other causes might be things like epilepsy, but those things are usually known about beforehand. And in fact, sometimes patients are diagnosed with epilepsy when in fact their problem's their heart because they end up having a seizure from the lack of heartbeat.
So what might have gone wrong?
So the patients that I see are patients that have had a cardiac arrest and simply we don't know why. Most commonly in the older age group, people have coronary artery disease. So they've had heart attacks, it's pretty clear what's going on and the presentation's straightforward. But the ones that we're interested in are the younger people between usually the ages of 1 to 40 who die suddenly without any reason.
And is that these inherited diseases, are they structural or are they electrical?
They can be either. So, for instance, as an example of a structural heart disease in a young person would be something like hypertrophic cardiomyopathy, which is a terribly long word, but effectively just means a thickening of the heart muscle. And this is an inherited condition. There may be other people in the family with the same thing. And in fact, the inheritance pattern is almost always 50-50. So for every child you have, the chance is 50-50. So you may have 4 children and have all 4 affected, but on average, you would have 2 of them. So that's an example of a structural problem. We can see that on a scan, or we can see that if the person dies, we sometimes see it first at post-mortem.
Right.
And it's really important to identify that so we can test other members of the family, potentially save them from the same fate. But sometimes there's a non-structural problem. So the heart looks absolutely normal, whether we scan it, test it, whichever way. And so those people can have electrically unstable hearts. And sometimes there's a little clue on the ECG, on the heart tracing that we do, that the electrical stability is just not there. And so sometimes diagnoses like long QT syndrome, we pick up on an ECG, and then we can again go through the family, do ECGs, sometimes genetic testing if we're fortunate, to identify as those at risk of sudden death.
So what proportion of sudden deaths like that is it due to an inherited condition, do you think?
Well, it depends on the age group. So as I said, those over the age of 40, 45 in Western societies, it's coronary disease.
Yeah. Everyone's got blocked arteries, right?
Yeah,
Pretty
it's
much.
very common.
Yeah.
Occasionally we'll see someone who's a cardiac arrest, we'll look at their coronaries, they're normal, we'll look at their heart, it's normal, and there's no problem. We will find something like that in an older person. But often it's the younger people. And in fact, under the age of 10 or 15, it's almost always an inherited heart disease. And that, that's a tragedy. And I don't know if you've had the experience of having somebody who's young dying suddenly and its effect on the family and the effect on the wider community and the huge impact it has. And if we can save those people, we have data from our New Zealand cohort that says that, if we have an unexplained sudden cardiac death, we can identify a cause in about 30%, which is not high, but if you think about those 30%, we can get on average about 2 or 3 family members who are also affected with the same condition and potentially save them. So I think it's really important to investigate them thoroughly and find a cause so we can help their family.
And you're saying 70% you would never find a cause?
We still may find a cause that would point us towards it, but often not a genetic cause. So we can often have other clues as to what's going on. Okay. So one of the things that we did is we got together 28 experts from around the world, and we put up an international best practice document on how best to investigate people who have unexplained sudden cardiac arrest or those who die suddenly and we don't know why. And we had cardiologists, pediatricians, we had pathologists, we had geneticists, we had genetic counsellors and psychologists, and also lay people come together from 13 countries around the world and put together this document, which we think should help physicians, no matter where they are in the world, investigate people thoroughly so that we pick up conditions like this.
And is this the first time a document like this has been written for this condition?
It is. There have been other documents on specific conditions that have been done, but this is more of a generalised approach to a person, how I would see them. They'll present to me with a cardiac arrest, nobody knows why. Okay, what tests are we going to do? What questions are we going to ask them? The family history is really important.
Okay.
And it's actually surprising
right.
how infrequently a proper family history is taken.
It's good for us to learn about the health of our family members so we can know what our risks might be. More from Dr. Stiles in the next segment. We'll meet Colton, our new exercise host, right after the break. So get ready for a warm-up.
Hey my friends, I'm Colton, your coach, and today we're talking about movement. Let's get moving. We'll start by just bringing those knees up and down. To my right, I have Angelo. Angelo here is going to be taking you through the options for every movement. If you want more of a challenge, we've got Una here. She's going to be demonstrating some of the more challenging versions of each exercise. Now, as we're bringing those knees up, let's cross those arms in front, and we're going to try and take the opposite elbow and knee and bring them together. As you're doing this, really focus on keeping that chest lifted. We're just focusing on rotation through the shoulders rather than any bending or rounding in the spine. You want to stay tall and proud as you bring those knees up. And as you start to warm up, you might find that those knees can come a little bit higher. Maybe they even do touch the elbow, but keep the elbow high and bring the knee up as high as you can to meet it. From here, let's go ahead and go into some butt kicks. All we're gonna do is try and bring that heel as close to our cheek as we can, one leg at a time, nice and slow. Again, it might not touch the cheek at first, but as you start to warm up, you might feel it start to loosen up through those thighs and allow that movement to increase just a little bit. If you want more of a challenge, you can take those butt kicks to double time, start hopping foot to foot. Today, the reason we're talking about movement is because movement is about keeping that blood flowing, keeping that body active, and keeping the body moving is so important for health and fitness. It is so vital to your longevity, to your quality of life that you keep that body moving. The recommendation is that we move every day throughout the day. So not just one time, not just for a workout, but make sure regularly throughout that day you're getting up and getting that body moving. From here, let's go ahead and give those legs a little rest. We're gonna take those arms and we're gonna swing them side to side, bringing them out and in. Feel that stretch in your chest as you reach back and your back as you reach forward. And again, as you start to warm up, you might be able to make those arm circles a little bit bigger. Give yourself a little hug. It's important in life that we have lots of affection and love in our lives too, so now you can show yourself just a little bit of love today. From here, we can take those arms up now. So swinging them up overhead. Imagine that you're trying to scratch your own back at the top, and then feel that stretch in your shoulders at the back, trying to make that movement bigger and bigger as you go. Next up, we're gonna take those arms and just complete that circle. So bring them all the way around forward. Nice and slow at first. Don't worry, we're gonna make this more challenging in a minute. Big, big, slow circles. Then let's take it back again the other way. Now we're gonna set those arms forward, reaching in front of us. We're gonna start with some big circles. And as we start to move, we're gonna make those circles smaller and smaller and faster and faster. And as you make them smaller and faster, you might start to feel those shoulders burn. Can you feel it, guys? We're gonna take it and we're gonna switch those directions, taking it the other way. Starting off small and slow and tight, feeling that shoulder burn, making it bigger and bigger and bigger. Now I need to step out of their way because they're gonna turn their arms out to the sides, starting big as they swing backwards. And then as we continue those rotations, let's make them smaller and smaller and tighter and tighter and faster and faster and faster and faster. Are they burning yet? I think we can go a little bit longer. Keep going, keep going. All right, let's switch directions. Let's start bringing them forward. Opening them up bigger, slowly, slowly bigger and bigger and bigger and bigger and a little bit slower. All right, shake that out, give those arms a little rest. Let's go to our lower body again. We're gonna go to some knee hugs. So this time, we've already loosened and warmed up those joints. We're trying to add a little bit more mobility as we go. So squeezing those knees nice and tight. Again, instead of rounding into it, try to stay tall and bring your knee up to your chest as you hug it. From here, we're gonna go to one of my favorite exercises, not just because it has a fun name, but the Frankenstein. So we're gonna bring those arms up overhead. Gonna take the opposite foot and hand and try to meet them at the front. As you do this movement, it's really important that you're not reaching the hand for the leg and rounding your back. Instead, keep that chest up and bring the foot up as high as you can. It doesn't matter whether or not you actually touch the foot. Maybe you do, maybe you don't today, but you wanna feel that nice light stretch through the back of the leg. You wanna feel it getting a little bit higher with each kick, but don't feel like you have to reach that foot. It's all good if it's here today. Guess what though? As you keep moving day by day, you're gonna get more and more and more mobility through those legs. You're gonna get a better feeling of looseness and mobility and openness and ease of movement throughout your day. And that really is what's so important about moving. So team, as we finish our little exercise here, go ahead and shake it out. You can take a little break here. Maybe we take a deep breath in at the top, breathe out and let it go, relax. Guys, that's it. It's as simple as that. Just move your body. Move it every day throughout the day. Thank you guys so much. You did great work today, my friends. I'm Coach Colton. Remember, more is possible for you. Commit to just making small changes in your life, and we'll give you the tools you need to be healthier, happier, and fit for a purpose, your purpose.
Nothing like a bit of movement to get that circulation going. Daniel finished his week in the mines and was getting ready for a night on the town when a severe headache and paralysis of the right side of his body stopped him in his tracks. Rushed to hospital, he underwent a long series of tests to figure out what was going on. Here's what they learned. Watch.
The test revealed that I had something seriously wrong with my heart, and that was with the left bundle branch blockage, and I had 2 coronary arteries that were blocked. As a consequence of those investigations, I ended up with what they call heart failure, functionality of the heart. During the angiogram, and what they did with the doctors, they'd put a small narrow thing up through your heart to squeeze dye out through either through your arm or through your groin, and they'd find out where the blockages were. But at that particular time, my body had an allergic reaction and it sent me into cardio arrest, another heart attack. I could just think about it now. It was just like an elephant stood on your chest, and I had trouble breathing, and I had this massive headache, and I was just blacking out, and the cardio specialist, he said, stop the procedure. As soon as he said stop the procedure, I came back out of it, but I knew I'd had a heart attack and how close I was to being, not here. I wanted to break down and cry, actually. and it was a shock. And here I was, I thought I was, pretty thing, and here I was getting the news to more or less to go home and wait till I die because I was a ticking time bomb with my heart. I knew I had to turn my life around if I wanted to get through this, because the doctors more or less said, look, just go home and enjoy what you got left. So anyway, that was quite a shock. So I went on this health on my own, that I needed to know that I needed to stop drinking, I needed to stop smoking, and I needed to go back on eating naturally where I knew how to be brought up. But it was all a little bit too late and I needed further help. I made the choice to get up and make something of my life for the Lord, in committing and rededicating back in of service to Him. And if I could do that through my health and turn things around, in order to help others. What happened from there, I had a brother living and working at a place called Misty Mountains in New South Wales. And it was a health retreat. And he had heard about my situation. And he was ringing me up and he was saying, you got to come down here, bro. You got to come down here. And for 12 months, he was answering me when I used to ring him up, or he used to ring me up to see how I was. And I'd say, yeah, I'll come down, yeah, but I never eventuated. And then I knew I got to the stage where things weren't progressing well. I knew that if I didn't do something seriously about my health in regards to finding people and reaching out to people who knew more about what I was going through, because I pretty much had very much a heart disease problem. So I jumped on the train and, I think about it now and we can see how marvellous His works are, God, how He watches over us, because I did have 2 turns coming down on the train. And at one stage, they had an ambulance waiting in one town for me to arrive on if I wanted to hop off, and I said, no, that's fine by the time I got there. And then the other one, I was sitting in the train in New South Wales and I had a massive hit in the chest. Finally got here to arrival time. My brother was there to pick me up from the train station. And I told him what happened and he brought me back up here to Misty Mountain.
And none too soon. We'll find out what happened to Daniel later in the show. Today's guest is cardiologist Dr. Martin Stiles. I asked him to outline the medical process following a death from cardiac arrest.
Yeah, well, hopefully that person has received prompt CPR and they've been rescued perhaps by defibrillation and they're neurologically intact, because that's one of the problems. We have people who have been affected by the lack of oxygen to the brain. But provided that's okay, you'll be asking them things like, is there anything in the family that's happened like this before? Tell me about your parents, your siblings, and your children, because it's those first degree relatives that contain the genetic information that we want. No one's that interested in their great aunt, right, or their cousin even. People sometimes grow up quite close to their cousins, but they're actually third degree relatives, right? They're your father's sister's child.
Yep.
So first degree relatives is where the money is. Is there any sudden death in the family? Also, sometimes we ask about, sudden infant death, cot death, or even intrauterine death.
So stillbirths and cot deaths can also fall into this category.
They can do. So when we talk about, the article that we wrote was about deaths from 1 to 40 in the main.
Right.
So under 1 is classified as cot death and usually has other causes. But within that cot death cohort, there may be some who are affected by rhythm problems that we can pick up.
Right. So you're starting with this person working back rather than starting at that point.
That's right.
And what would come next after taking that really thorough family history?
Well, we have these sort of, I guess you'd call them tier 1 investigations, where you do ECGs, you do ultrasound tests of the heart, you might do some blood tests, and you'd get some, basic information about the person. And then if you wanted to go a little further, sort of the tier 2 investigations, like an MRI of the heart, provocative tests, you might monitor their ECG while you're giving them a drug to try and provoke a problem. You might Exercise test is probably tier 1. You know, there's other tests that you do just to try and
put the heart under a little bit of strain and see how it responds.
And then if you come up with a diagnosis or you think you know what's going on, then genetic testing can be really useful.
How is that done?
Usually with a blood test.
Okay, and what does it tell you?
Well, firstly, when we're talking to somebody about a genetic test, we want to counsel them about the implications of a genetic test. And people don't often think about what the implications might be. So for instance, it might have implications on your career. It might have implications on your medical care, even your medical insurance, your life insurance. And so, for instance, you know, sometimes when we're getting family members and we have a diagnosis of, say, long QT syndrome in somebody who survived a cardiac arrest, we have a genetic diagnosis on them, we'll get the family in, we'll do their ECGs, and then we may offer them a genetic test. But before we do the ECGs and the genetic testing, we might say to them, are you insured? Do you think now's a good time to take insurance? While you can truthfully say...
You have no pre-existing conditions.
Exactly right. That's right. And it sounds a bit devious, but in fact, it's very important. It's very important for people. And they might be 23, 24 years old. They've never thought about life insurance.
No.
But, you know, in 5 or 10 years' time, they're taking out a big mortgage or they're borrowing money to go into business. It could be a real barrier.
Wow. Never would have thought of that.
Well, we've had helicopter pilots, you know, literally finish their training only to find that they've inherited some nasty condition, which is a terrible thing to have to tell them.
Yeah. Life-changing.
Life-changing.
For them. Yeah.
But on the other hand, we've now identified something that we could potentially stop them from dying from. So, you know, your career is important, but there's no career without your life.
Life-changing indeed, though at least something can be done that's life-preserving, which we'll hear from Dr. Stiles in the next segment. Stay with us. Welcome back. Now is the time that you ask the questions. Steve from Maine asked, I crave vinegar, but do you think I should be cutting back? Well, the pH in the body is about 7.4, and we all know that vinegar is an acid, it's acetic acid. It has a pH between 2.4 and 3.3, so that's acidic enough to erode tooth enamel. It can also trigger inflammation in the esophagus or the gullet and the stomach, and it can trigger nausea and acid reflux. So there are symptoms from eating a lot of it, even though people do that. It may be better to replace it with a little lemon juice, which is still acidic, so it gives food that flavour and that bite, but in the body it's metabolized to an alkaline. But don't drink lemon juice all day, because that really will erode your tooth enamel. Someone else asked, I'm concerned about GMOs, toxins in our greens, and not eating corn anymore. I'd like to know more. Well, there's a lot of debate about this subject. Genes are inserted into plants in an imprecise way in order to give them resistance to insects or viruses, tolerance to certain herbicides, or to enhance them nutritionally. The tolerance to herbicides means that now farmers can use more herbicide on your food crop. It'll keep the weeds down, makes the farming easier, the prices go down, the foods become more available, and you're going to eat more. However, I actually don't like the thought of eating herbicides in my foods. Increasing the protein content sounds like a good idea, especially for developing countries that might be struggling to provide enough protein for their population. But on the other hand, we actually don't have enough independent research to know that those proteins don't trigger allergies or problems with health. So if you want to avoid GMO foods, it's very difficult because they're not even labelled on the shelves because of the stigma around GMOs and the biotech industry doesn't want to label their foods. Now, we've done a couple of shows on GMOs that you might want to look up on our website. Sharon called to ask if we have a cookbook available. So this is a really common question, so I just want to get it out there that no, we don't have a cookbook. We just put the recipes up on the website, gohealthy.hopetv.org. Thanks for sending in those questions. If you want to know more or you want to get in touch with us, then use the contact details on the screen. Now let's head out into the fresh air to check out some fresh produce. Blueberries are loaded with antioxidants and flavonoids. They rank among the top disease-fighting foods. One serving is half a cup, and that can counteract the effect on blood vessels of smoking one cigarette. And if you don't smoke, it improves vascular function within an hour of eating them. It also lowers bad LDL cholesterol. Recent studies have found that 3 or more servings a week can reduce the risk of heart attack by up to 33% for women. So basically, they are great for heart health. Eat them every day for 6 weeks and you'll see a kick in your natural killer cells, which give viral infections and cancers the boot. So that's immune enhancing. They're also anti-inflammatory, improve insulin sensitivity, and long-term slow cognitive decline by as much as 2.5 years. But how much should you eat? Well, more is better, with increasing benefit up to 1 to 2 cups a day. But that's an awful lot of blueberries. So if you can afford it, just eat half a cup a day, and they're just as good cooked, frozen, powdered, but they taste best fresh and raw. Bon appetit. Now those are yummy heart pills. We're talking today with Dr. Martin Stiles, a New Zealand cardiologist who's working on a national database for genetic conditions that cause sudden cardiac death in those under 40. I asked him what can be done to prevent an event for someone who has a gene that puts them at risk of sudden cardiac death.
Well, sometimes you can give them medications, just simple things like beta blockers or other medications. A daily tablet may improve their prognosis markedly. Sometimes you can do operations which might help them. Sometimes, ultimately, you might put in something like a defibrillator. So a defibrillator is like a pacemaker. It sits there most of the time doing nothing, but if you have a cardiac arrest, it'll shock your heart and you'll likely regain consciousness. Now, it's quite a big thing to do, to put a defibrillator in, but ultimately worthwhile if you're saving their life. But all these things we're talking about, the insurability, the employability, whether your defibrillators going in, what medications to do, whether you should have an operation, we counsel the patients beforehand. And one of the things about this article that we published is that we have, somewhat uniquely, a section on genetic counselling and a section on psychological care. Because these patients come to your clinic with quite a lot of baggage. They've just survived a cardiac arrest, or they've just lost somebody. So somebody's died, the postmortem may be negative, but we think there's an arrhythmia problem. We get the family in, we want to investigate them really carefully, but it's emotionally fraught because they've just lost somebody and you're talking about it and you're trying to prevent it happening to them.
We've talked about the scenario of someone who had the cardiac arrest and was resuscitated. What about someone where you're dealing with autopsy results? The heart looked fine.
Yeah.
Is there any way of checking them genetically to see if they were carrying something?
Absolutely. So one of the situations that you've mentioned, the autopsy negative sudden cardiac death, we have an opportunity to take some genetic material. So we generally ask the pathologist at the autopsy to save some genetic material that we can test later. So that's one of the important things.
So that's knowing it when the event happens and asking the pathologist to do it,
to store something
in advance, rather than going back and saying, well, this autopsy result is now negative. Can you go back and get tissue? It's too late. Huh?
It is too late.
Yeah.
There are some really good examples. We've had some data out of Auckland where they went back and got the Guthrie cards, the baby heel prick cards that you do. And there's, rooms of these cards, and you can find your card from your heel prick test when you were a baby and salvage genetic material from that. But we'd much rather have a test tube full of blood, as you can probably imagine.
Yes, or even organ tissue.
Tissue, anything at all.
Yeah.
Yeah.
So it's. Are pathologists aware of this? Are they aware enough, or is this going to raise awareness?
We aim to raise awareness. So Mary Shepherd was our pathologist from the UK. She works at St George's. She's internationally recognised for this. And the way the St George's people have done it is they offer a second opinion on pathology specimens within, I can't remember within a week sort of thing. I can't remember the date.
Wow.
So anywhere in the country they can send this and say, what do you think of this? Is this normal? Is this abnormal? Because, a specialist cardiac pathologist will have a better insight as to what's a normal piece of tissue and what might signify something important.
And do we know which genes we're looking for?
Yeah,
when we're
we
looking
often do.
Yep.
And one of the problems that we face is that we might test 8 or 12 genes for this condition that we know about, and we might get a mutation that we definitely know is nasty, It's been seen in other families, so we have the diagnosis, what we call a pathological mutation. But we might find a variation in that gene that no one's ever seen before. So we know that mutations in this gene can cause nasty disease, but here's something new. Molecular autopsy is the term that we give for when we may have a negative real autopsy and we want to get to the bottom of things. And what we can do is run a test for some of the known genes that can cause sudden cardiac arrest in the hope that something will turn up that is important. But what we've been really cautioning people is this, blunderbush approach where you just try and shoot and ask questions later, because this is where these variants of uncertain significance come in, and you can get down a blind alley pretty quickly. So then
you're raising more questions than you're actually bringing answers.
That's right. So really we want to lead it clinically. We want to know what the ECGs are. We want to know what the family conditions are. We want to know what the imaging tells us. All those sorts of what the autopsy tells us, so we can at least focus our genetic investigation.
So get that first.
Yeah.
And then look at the molecular makeup.
Yeah, that's right. Lead with the clinical stuff and follow up with the genetics. If you lead with the genetic stuff, very quickly you're down a blind alley.
More after the break, so stand by, but first, some food for thought. Being born carrying a gene that puts you at risk of sudden cardiac death is a very sobering thought, especially when most people who carry the gene have no idea that they do. And then, when it happens, there's no warning. So, spiritually speaking, we all have heart disease. And it can be eternally fatal unless we take action. In Matthew 15:18, Jesus said, "What comes out of the mouth proceeds from the heart, and this defiles a person. For out of the heart comes evil thoughts, murder, adultery, sexual immorality, theft, lies, and slander." Wait a minute, I hear you say, "I've never done those things." Well, actually, apparently we tell 10 to 200 lies every day, including 1 or 2 that we tell ourselves. But don't give up. God has a preemptive solution for our heart disease. He promises to take away the stony heart that's hardened by years of sin and to replace it with a new heart and a new spirit. So take action and let God perform your heart transplant today. Today's guest is Dr. Martin Stiles. He chaired the International 2020 Expert Consensus Statement on the investigation of patients with sudden cardiac arrest and their families. I asked him how many countries were involved in the creation of these international guidelines.
So this was led by the Asia Pacific Heart Rhythm Society in partnership with the Heart Rhythm Society from America. And we had other groups like the European Heart Rhythm Association, Latin American Heart Rhythm Association, pathology associations, genetic counselling, so a whole lot of interest groups, right? And we tried to, the 28 authors represent those interest groups. But it was chaired by Arthur Wilder from the Heart Rhythm Society, who happens to live in Amsterdam, and by me from Asia Pacific Heart Rhythm Society. And it's the first such document that Asia Pacific has led. So it's been quite good for us.
Yes, because you're usually attached on the back of things, right?
Yeah, that's right. So we led it this time, and it was nice to see. It was also quite nice because Arthur, he came out in January to New Zealand from Amsterdam, and we stayed in Whangamata, and we were doing this in the morning, and we were on the beach in the afternoon.
Oh, I like that kind of research.
It was great.
Yeah.
I can tell you, straight from Amsterdam in January, he had the whitest legs on the beach.
That's very cruel.
he knows. I teased him about it. Yeah, but I think, and then he and his wife, they went around New Zealand, and for much of January saw the whole country. They saw more than I've seen, and they did well, and they had exquisite timing.
Oh, yes. So, what's the future for your register here in New Zealand with this kind of guideline?
So in New Zealand we have the Cardiac Inherited Disease Registry, and we a registry across the country where we try and register the people who've been affected by it and their family members. And we draw a family tree. We have a specialised program, a bespoke computer program to draw family trees, and you can click on the person on the family tree and it opens up their investigations and what we think and their genetics and whatever we need to do. And, you know, you might find that someone in another branch of the family lives in another part of the country. And of course, you know, people are spread around throughout New Zealand and even overseas. So we try and make those linkages and we keep the data in one place. And, you know, we can help coroners decide on causes of death. We can help families move forward from tragedies. Because, you know, when someone dies in your family, if your child dies suddenly as a teenager, what do you want to know? You want to know why.
Why? Yeah, and will it happen to any of my other children?
And will it happen to anybody else? That's right. And if we can help answer that, it actually makes a big difference.
Amazing legacy.
It can be rewarding.
Yeah.
It can be very frustrating. We have to tell people we may not find an answer at all. But even the act of someone trying hard to find, that happens to heal people as well, I think.
Very true. Fortunately for Daniel, his bad habits didn't cost him his life, though they did clog his arteries and cause a cardiac arrhythmia with heart failure. During a routine angiogram, a reaction to the dye triggered his heart attack. At the time, his brother was living at Misty Mountain Health Retreat and repeatedly invited Daniel to join him there. Daniel held out for a whole year before agreeing to accept that help. Setting off by train, he almost didn't make it, but God had other plans. Watch.
When I first came here, I only could walk 10 metres and I could only walk with a walking stick. The program that I did was just unreal, following God's 8 laws of health, which is nutrition, exercise, water, sunshine, temperance, air, rest, and trust in the divine power. How all those things work together. And they are fundamentally based their program on this, which is fantastic and great. I was able to put into practice what they were teaching us. And that was unreal because I ate all the wonderful foods. I drank the beautiful fresh water that they have here. I was able to do the wonderful exercises. Like I said before, the fresh air that was out here. And it was just fantastic. Now I'm walking quickly without the help aid of a walking stick. I'm jogging, going up hills. When I first arrived, I couldn't do anything like that. And I'd walk a little way and then stop. And so these are the things that I felt I know the healing power of following the 8 laws of health. And if you follow that and you be diligent and faithful to that, your body can, given the right conditions, will start to self-heal. Through the process of the last 6 months, finally to eliminate all the medications that I was on. So that's been just an amazing thing for me, to be able to be off all my medications and to maintain a healthy lifestyle and feel so well. So it's been a process, it's been a good process, it's exciting. And I'm feeling so much better, just mentally and physically and emotionally. Prayer has been such a wonderful thing. Trust in God is the most important thing, because without Him and without His protective care and to give us every day the ability to go forward and do what we need to do, I must stress that without God in my life, I wouldn't be here today. And that's the most important things, apart from being the health that He's able to restore with me, to give me back, what I need to be able to live a productive life and live a healthful life and live a life that's in service to Him and in order to help others. And that's where I am at the moment today.
A life of meaning and purpose, that's when you know you're really living. Sudden cardiac death is uncommon but very serious, and we should all learn how to do CPR to save a life. For survivors of sudden cardiac arrest or relatives of victims, it's really important to find answers, to ask around the family for a possible genetic cause. It could mean that you can save another family member by asking the right questions, finding the right experts, and getting the right tests. That's all from me today. Thanks for joining us on Go Healthy for Good. I'll see you next time.